Good afternoon. I'm Tim Steinhauer, Superintendent of Schools. I wanted to give you a brief message today about some information that we gave both our parents and staff over the weekend. We had 2 positive student cases and 3 positive employee cases that all involved the high school. I've asked Dr. Ron Davis, our Assistant Superintendent for Secondary Education, and our Pandemic Coordinator to join us. And also I've asked Deanna Hess, our Chair of the Health Services Department, to answer some questions that you may have posed to us over the weekend that you may be considering. So let us begin with talking about some of the most frequent questions we get about when schools open and close. And given the number of cases that we had at the high school, why don't you explain, either Deanna or Ron, explain why we are not closed right now.
Sure, I'd be happy to start. Thank you, Dr. Steinhauer, for this opportunity to provide additional insight for our staff and our community. A lot of the information that I'm about to share has been provided to our community in writing, but I think it's also good to elaborate verbally so our community has a good understanding. So this process does start with guidance that we receive from the Pennsylvania Department of Education. It's in the document Recommendations for Pre-K to 12 Schools following identification of a case of COVID-19. We provide that link in our health and safety plan for any family that would like to look at it or any staff member who would like to look at it. So when you look at the guidance that we receive from the Pennsylvania Department of Education, there clearly is a table in this guidance that talks about when it's prudent, whether we're in the low, moderate, or substantial ranges about closing a school. And typically it's incumbent upon the number of cases that a school is experiencing. And in our particular case, we're certainly in the moderate range. And as you've indicated, we had 2 students and 3 staff members test positive over the weekend. So the question would be, why isn't in the moderate range, why aren't we closing? What I would point out in that document that you got from the Department of Education is that there's an asterisk right behind the number of days that a school is supposed to close. And that asterisk refers you to the bottom of the chart. And when you look at the language at the bottom of the chart, it really is case-by-case decisions in consultation with your local health department. So procedurally, that is exactly what we do with every case. Any situation that comes up, whether it's a student or an employee, we collect all of the information that we have available. We share it with the Allegheny County Health Department. They review it, and then they provide us with guidance and recommendations on how we should proceed. So yes, the chart does say that we should close for 5 to 7 days, but when you apply the asterisk that's in that same chart, and you look at the language below the chart, and additionally the language above the chart about the consultation with the health department and making case-by-case decisions. In this particular case, there was not a recommendation to close. It was, particularly for the staff member scenario, there was a recommendation to re-clean the areas in which those staff members had impacted. And we were able to successfully do that before the students arrived at school today. So based on the guidance that we received and in the guidance that we received from the health department and the guidance that's available from the Department of Education, it didn't seem that it was warranted for us to have to close.
So why don't we delve into that just a little bit. Deanna Hess, would you explain a little bit why a strong partnership between our school and the Pennsylvania or the Allegheny County Health Department is so important, and explain a little bit of your process and why do we need to be so detailed with the health department?
Absolutely, and again, I echo the ability to do this is huge for the Gotha community and our district here. So to open or close a building is ultimately made by Dr. Steinhauer, but we do work with the county health department with Dr. Brink, who is our director of epidemiologist there, along with one of the nurses in her department that has been dealing with this with us since March of this past year. And it is so important that we have that relationship because we call them 7 days a week, pretty much 24 hours a day. And the information that we get, both from our staff and our students, our parents, is important because we start that contact tracing. We start finding out where the exposure was, who was involved in it, and those are all extremely important information to give to the county health department so that they can make an informed decision as to does it affect us directly, was it outside of our district or outside of our community. with all of that information, they are able then to give us the direction to close, re-clean, whatever that might be, given this case-by-case basis.
Well, that seems to make a lot of sense. The original chart that the Pennsylvania Department of Health came out with, PD came out with, was a general guideline for us to use. And really the specificity, knowing the details of where the exposure was, how long it was, what were the circumstances behind it, are really the critical factors of making these decisions of whether about closing our schools or keeping our schools open. So Ron and Deanna, the issue of how COVID is spread, whether it's in school or out in our community, is a critical factor in determining whether we should open or close. Would you mind explaining a little bit about what community spread is and the difference between in school and out of school, and why does that matter to us?
Sure, I'd be happy to start. Because I think it's important to note for our community that we use the term community spread, at least in these last two letters, as we're trying to provide context and circumstances in our explanation as to why we're closing or not closing. In these two particular cases that we're referring to today, both of those scenarios were what we used in the letter community spread, which means that the origin of those cases are not the high school. They were outside of the high school community, and they were spread because of circumstances and situations that occur outside of the high school community. So when we were using the term community spread in these letters that we just released, what we're trying to communicate to our community is that these are not situations that are directly related to the high school.
So Ron or Deanna, do we have any confirmation of in-school transmission occurring?
Not with these most recent cases. They are not anything to do with the in-school transmission. Actually, they were also outside of our Mount Lebanon community, especially the one section of the positive ones. And the students that were involved were not anything to do with the in-school connection.
Now, we can't separate what happens in the community from what happens in our school. Right. So why is that a critical element of it?
Can I go?
Sure.
Sure.
Sure. It's a critical element because, again, we're looking at, when we look at close contacts and contact tracing, since we are the first line to start that, if they are in like the same cohort, in the same grade, then we start to look at a little bit more closely, okay, what activities were they in? What were they involved in within our school community versus outside at their homes that may not have had contact with each other? They just happen to be separate cases, just attending school at the same time.
Thank you.
And Dr. Steiner, if I can add in, I know Deanna used the term close contact. So a question has come up in the recent weeks about the Center for Disease Control changing the definition of a close contact. We're clearly aware of the change in the definition. And as soon as that change came out, we reached out to the Allegheny County Health Department to get their insight and their guidance. As of today, as our conversation is going on today, I know the Allegheny County Health Department is reviewing the new language relative to what is a close contact. And until we get formal direction from the Allegheny County Health Department, we've continued to rely on the previous definition of 6 feet of physical distancing for more than 15 minutes.
Deanna and Ron, at the very beginning of the pandemic, March and April, the Allegheny County Health Department, Center for Disease Control were giving advice to close down entire classrooms, close down an entire team, if there was, or close the school down if there was just one case reported in that school. How has that guidance evolved?
Let me take it?
Sure.
Okay. I think part of it is that there has been so much that has been learned, even though there's still a lot of what ifs with this pandemic. What they have learned over the course of time is that wearing masks helps. Physical distancing, which none of this was being done in the very beginning of it, that really didn't start until midsummer. They thought initially it was explicitly a contact virus. They now know that it is airborne and that it is respiratory droplets, so it's much more easily to be cleaned, taken care of. So now they're looking at close contacts versus just everyone was together in a room, because we've also asked people to physical distance. We've asked people to maintain and limit their contacts and to be with them each other as least amount of time as possible. And that's where the 15-minute consecutive minutes comes into play. The county also added in the beginning of October, close contact includes not sharing utensils of anyone, obviously hugging, sneezing, coughing on someone. All of those things were not included in the beginning when they were staying, send everyone home, close everything down. They really realize now that that is not how best to handle the transmission of everything.
So, Dr. Davis, in our health and safety plan under the hybrid model, what are the strategies we are using to limit that close contact and mitigate some of those factors?
Certainly. So the hybrid model in itself is a mitigation strategy because we're de-densifying the number of students that are inside a particular building. So it starts with that system or that process of taking the group of kids and dividing them in half. Additionally, as the community is well aware, we also have a cyber learning academy, an opportunity for families who would like to take advantage of that to continue to learn remotely 5 days a week, which continues to de-densify buildings. So those two strategies do provide less congregate settings inside a school. So once students are inside a facility, there are other strategies that are implemented. As examples, desks are typically 6 feet apart where possible. And you see when it's not possible, we use barrier boards or ultra barrier boards. Masks are common. Masks are a requirement inside the facilities. The exception to that is when students are eating lunch, they are permitted to remove their mask to eat lunch, and then they put it back on. Our health and safety plan does call for a mask break. And over the course of the last couple of months, we've gotten additional clarification about what defines a mask break. And the health department is pretty clear that it is for no more than 10 minutes, and people have to be 6 feet apart. And I think that aligns nicely to the previous definition of close contact, because they're looking at 6 feet apart for 15 minutes. So this idea of a mask break for people that are 6 feet apart for less than 10 minutes would not violate a close contact. So you look at those strategies that are employed. We have shut down water fountains, throughout the buildings. We've asked kids to bring their own water bottles in and use our bottle filling stations as a way to mitigate people, utilizing water filling stations in the breath that would occur onto a typical water fountain that you would see. What you see in a number of schools is kind of new traffic patterns, whether it's arrival and dismissal at school or staggered bell schedules throughout the course of the day, or we're limiting the use of lockers throughout the course of the day. All of these are strategies to reduce or mitigate the number of students congregating in one place at one time. So there's a number of strategies that I've just alluded to in our health and safety plan. Those are just a few of the examples.
And we were given guidance by both CDC, Allegheny County Health Department, even local partners such as the St. Clair Hospital that gave us some review and suggestions, along with our school physician has reviewed our plan. So we have put all those steps and processes in place to mitigate those factors about close contact, about physical distancing, about wearing masks. So those are all good strategies that we're trying to employ.
You're absolutely right. And as you recall, in the summer, whenever we were having those workouts with athletic teams, we did shut down entire programs just because of one case. And as the information has evolved, the strategy is now more targeted mitigation as opposed to a blanket shutdown of programs. So that we are really looking at this idea of targeted mitigation and seeing where there are opportunities that need to be mitigated and addressing them directly.
And that seems to be true, Deanna, with contact tracing. When we're looking at kids, some may be in the A cohort or the morning cohort or not even in school at all, maybe in the cyber program. So the specificity of knowing where that student was or where that faculty member was or that staff member becomes so critical in that mitigation strategy and determining what we should or shouldn't do. Let me ask both of you, have you received any guidance from the Allegheny County Health Department or any other public health official as of today telling us that we should close down a school, close down a program? Have we received any confirmation about that?
No, I can speak to that. No, again, our conversation with the County Health Department last evening was that they would like the buildings that the employees were in to be recleaned if possible. If that wasn't possible, yes, but it was absolutely made possible before the students came in. Again, there was no contacts, close contacts of anyone else within the buildings that we are aware of at this time. We are still working on some things with it, but as far as an activity goes too, what has helped so much is the directors and the coaches have all been notified of mitigation strategies such as separating people more, wearing masks better, even inside or outside. And because of that is one of the main reasons that we have not had to shut down any activities, especially from this weekend.
So what becomes very critical in this process is tracking both student and employee cases that come up. Can you explain a little bit about our process and where we're keeping track of those and how you use that information?
Well, I'd like to start with that particular question because as we've indicated a number of times to our community through a number of correspondence that have gone out is that if a student or an employee is not feeling well, they should stay home. And that is critical to this process. And then when we learn of people that are not feeling well, Deanna and her team of nurses inside our building, we created a tracking document that allows us to identify each and every person that we're aware of, whether it's a student or an employee who might not be feeling well, what their symptoms are, whether or not it's COVID-related symptoms, and what the recommendation is from either their PCP or our nurse. And then, Dan, I'll let you pick it up from there and talk about that tracking document and how it correlates to your decisions with the health department.
Absolutely, thank you. Yes, and that is correct. If you're not feeling well, stay home. That's obviously the biggest concern of ours at this point. And if you're not feeling well, to let your school building nurse know. Principal, school building nurse, then it comes to me. And then, as Dr. Davis has said, we have a tracking mechanism that everyone that we are notified of goes on that, a separate for employees and a separate for students. Once I get the basic information as far as symptoms, when the last exposure was, I look at if anyone else in the family has tested positive or has been a close contact. I crunch all those numbers and put the dates in of all of that. I then contact the county health department immediately. And we go through every person case by case, and we determine a return date. The return date could either be isolation. Isolation is if you test positive or have symptoms, or quarantine. Quarantine is if you are testing negative or if you are a close contact and have not tested positive. And there is a big difference because quarantine is up to 14 days, isolation is 10 days. And I know that probably doesn't seem right, but quarantine is because you have up to 14 days of an incubation that you could potentially develop symptoms if you have not tested positive or have symptoms. All of this information comes directly from the Director of Epidemiology at the County Health Department. I give a date, she looks it over, says yes or no. I then contact the families of the students or the employees directly. Everyone I contact every time we get of a case and give them a return date. And then from that point in time, if it's an employee, obviously administration is notified. If it's a student, the principals are notified so that we make sure that the student is not back in the building or any activity prior to them being able to actually return.
And what I'd like to add to that, Dr. Steinhauer, is that we recognize the importance of trying to provide as much information to our community as possible while balancing people's right for confidentiality.
Yes.
And even when you look at the guidance that's provided to the district, the concepts around confidentiality are included in that. So we are trying to provide as much information we can to the community without disclosing or identifying a student or a staff member who may be impacted by this. So what we've tried to do is then we aggregate numbers and they're placed on the district's website. There's a COVID tracker dashboard on the district's website. The language that we talked about earlier on in terms of how we're to look at each case by case and have conversations with the Allegheny County Health Department in consultation to determine what our course of action is. That information is provided on that dashboard. And then the dashboard is an aggregate number of cases that we're currently dealing with, either active or inactive. And we certainly recognize that some of these cases, we're reporting them as active, but they really do not have a direct correlation to the district because it's been, in two of our cases, over 14, I think it was 14 to 18 days since that particular individual was even in the school. But we do feel like we have an obligation to report that as a case, even though there's not a direct relationship, or direct impact is probably the better word, to the school. And then all the letters that we put out to the community are also located on the district's website under COVID communications.
So the COVID dashboard does indicate every case that we are aware of in the district, whether active or inactive. It includes the number of quarantine students who are on that. It also includes the total number of cases. But there is a story behind that specific number. It's not just we have 3 active, 2 inactive, and we should be closed down. The story is we really try to use targeted mitigation, discussing each case with the Allegheny County Health Department, knowing the specific circumstances of that situation, and then make a decision based upon that information.
And just to clarify, the dashboard reflects positive COVID-19 cases. Not every case we're dealing with, because if they turn negative, we don't reflect them on our COVID tracker dashboard. So that dashboard is really just about COVID positive cases.
Thank you. I'd like to reiterate with our entire faculty and staff that there is a lot of detailed information about COVID, the strategies we're using, the number of cases that we're tracking, and those are our students or staff who are involved with school. So we are tracking and keeping accounting of all students who have contact with school. For example, all of our hybrid students are noted in that information, and all the students who may be in the cyber program but may be involved in a school activity such as marching band or sports, we are keeping track of those. So those are the children and staff that you'll see noted on our COVID-19 dashboard. So as we wrap up today, we gave you a brief overview of the decision-making tree and the process that we use and the documents that we use to help us make decisions. And most importantly, that strong partnership between the school district and the Allegheny County Health Department. So all those strategies help us make good decisions about whether school should open, whether it should close, whether classrooms should be closed or open, or students should be quarantined, or staff should be quarantined. Those are all really targeted decisions that we make with the full consultation with the Allegheny County Health Department and the information that we know about each specific circumstance. On a general note, again, I'd like Deanna to give a broad overview of the tactics and strategies we should use to help mitigate the spread of COVID-19 in our district.
Sure, absolutely. One of the first things that you should do is self-screen. Whether you're a student or an employee, you need to self-screen, complete that process either prior to coming to school or coming to work. If you answer yes to any of the questions, you need to immediately notify your building nurse, who will then notify myself. If you are ill, stay home. If you are being tested for COVID-19, you need to stay home until the results of that test are back. Maintain physical distancing of 6 feet or more. It is extremely important to maintain that distance whether you're inside or outside. Wearing a face covering at all times inside. You also should be wearing a face covering if you're outside and you cannot physical distance of 6 feet. Decreasing your contacts to less than 15 minutes when possible. Limiting your contacts. Avoid that congregate setting where you're in a small indoor spot where the transmission could potentially increase. Hand washing, frequent hand washing, frequently cleaning touch surfaces if you're, especially in your homes. Cleaning and disinfecting any surfaces that are common areas. Reducing occupancy and ventilation, and again, this goes back to our hybrid, cohorting half the students at a time. We have either the MER of 8 or 13 throughout the school district, which helps to decrease the transmission of the respiratory droplets. And again, one of the biggest things is staying home if you are ill. We really want to have everyone here in the district, but we want you to be healthy. We want you to be safe. And following these guidelines put forth by the Department of Health and the County Health Department, we feel will help us to accomplish that throughout our district.
So, Dr. Davis, Nurse Hess, thank you very much for spending a few minutes with us, helping to clarify some of the information that we've been putting out over the last couple of days. Again, thank you all for watching this video, and if you have additional information, please go to the district website and look under the COVID-19 tab.